Hi, this is Josh, Dream Body Clinic. Welcome to DBC Diaries episode 38. And I'm here today with returning patient Filippo. How are you doing?
I'm doing good, Josh. Very good to be here.
Great. And this is your second time here. Last time you came all the way from northern Italy, right?
Yes.
It's a long ways to come.
It's a very long trip. Yeah, I tell you, man.
But it sounds like results, you saw results from treatment. You're feeling good. What all did we do last time? I think it was knees, back?
It was knees mostly. So the most important trouble and problem that I had, why I looked for this kind of treatment, was my back. So I had surgery last January 24. Okay, and I do contact your clinic, and I do decide to choose for your clinic, to be really honest, for your honest approach. Because at that time, before surgery, so I send you images and you check it with the doctor, and the doctor claimed, look, we can't help. And it was a really, really honest approach to me.
Nice.
So it sounds like a really honest approach. And it's something that I do also do my research and contacted many clinics all over the world. And most of them, they claim, look, come, we can help. So, and I did decide to come after surgery. So, because I definitely decided with a surgeon that, in my case, it was needed.
Yeah.
For better recovery after the surgery. So you claim now we can help in some regeneration, get rid of inflammation and all the scar tissue that I've got. Also for the surgery as well. Yeah. So this was the main reason that I decided.
Got it. Yeah, as we were looking at the images, and was it L4, L5, or which disc was it that was herniated?
It was L4, L5, L5S1.
Got it.
Okay, but there was also spondylosis. Spondylosis. And basically, the surgery was about for spinal stabilization. So they do perform dynamic stabilization instead of a fusion.
Oh, okay.
So it's a similar technique. So basically, there are a screw and a rod connecting the screw, but this kind of rod is kind of flexible. Okay.
Oh, okay.
So it didn't fix your back. So it's in fact, so the mobility is still, it allows the mobility while stabilizing the spine. Okay.
Good.
Probably longer recovery in that kind of, but maybe better outcome.
Got it.
In the end.
Yeah, and then we saw you did have originally when you came a bit herniated disc, and so we did treatment. They're still herniated, but we noticed less herniation and ton of inflammation reduction, because that was a big before, and you were in a lot of pain before, and I think you were saying you feel a lot better now, right?
Yeah, from 1 to 10, I tell you. So in the worst days, I'm maybe at 1. Okay, right now. While when I came here, I was recovering, not in the worst condition, because as you say, it's a long trip. So if you are at 10 pain, so you can even think about it. And I was at 5, 6, but now I didn't even call a pain. It's the kind of discomfort in my sciatica. Okay,
that's awesome.
It's a kind of discomfort. So the quality of life, definitely improve.
Oh, that's excellent.
Consistently. So
good. And how are your knees feeling?
Oh, the knees are good. So they are cracking anymore, but not hurting. Okay. So I saw a little bit of improvement, let's say. Okay. Yeah.
No pain, no problem. I mean, that's cool, right?
Yeah, of course.
Cool. And then we did the intrathecal. So gets up to the brain. Did you notice any changes brain-wise, like dreams, memory? How are you feeling?
Look, maybe. So I think it's most difficult to notice instead of physical condition.
Yeah, it's anecdotal.
But I think I'm more relaxed. I'm more stress-free. Okay. So I can manage stress that everybody has. Working, so for your job, for life, for whatever. So that's a kind of improvement that I saw.
Excellent.
We are taking intrathecal for trying to improve also the nerve damage that I had. Because I tell you, so maybe I don't think you do remember. This last is my third back surgery.
Jeez.
So it's a kind of degeneration. So unfortunately, I've taken this decision back in times, and I was too young to have a surgery.
Yeah.
Because yeah.
Well,
Now I know it's a kind of destructive approach.
Yeah.
They fix something, but to fix something they do remove stuff, generating instability.
Yeah.
And
I think that's a big thing people don't realize, that my mom had a fusion on her back for these polyps that kept forming. And, we were able to get her pain free with just the IV, but it's been 5 or 6 years. And now, where she has the fusion, I think it was like L405, is now the discs above it were starting to herniate because they were taking all the pressure. And so she had to do the back treatment to fix that. And it's, you fix one problem, but sometimes that can lead to other problems. And the cool part with the stem cells is it's not very invasive. It's really fixing tissue, rehydrating discs, and trying to get people back there. So that's the goal with us.
And the earlier the better, I guess. If you take earlier.
3 surgeries, man.
I decided to bring my mom as well and my dad. My mom is in a even worse condition than me, so maybe you can help a little bit. So stem cell can help a little bit.
We're gonna help out your mom today. That's the goal. And your wife came this time too. So and you brought the whole family. That's awesome.
My wife performed her neck last time.
Oh,
so
that's right.
She almost immediately feel better.
Really?
And she never had any trouble in her neck. So
that's awesome.
That's why. So probably in a better condition. So not very bad. So the efficacy of the stem cell are very good. So and there's no need for a new treatment. So instead, she's taking only the facial. Good. Why not?
Well, and
since you're there.
I think that's great for people to realize. I mean, like, look, sometimes there's a lot of damage. Filippo's case, it might take more than one treatment. But like you said, I mean, you went from like a 5 or a 6 down to a 1. I mean, you didn't need to do treatment again if you didn't want to, but you just want to keep the progression going because you know what you have might keep going. But then for his wife, we did her neck and 1 and done. She doesn't need to do her neck again. That's awesome. We're just, just the vanity treatments, get the face looking good, which I do probably twice a year. I love that treatment. So it's really good for the skin tone, build back the collagen. It's not like Botox. You're not instantly wrinkle free, but it's more natural. It's like slowing down the aging process. The facial treatment's awesome for that. Yeah. Well, man, thanks so much for coming back. Thanks for sharing with people at home. We're always telling people we get people from all over the world, and, Filippo's a great example of that. Came all the way from Italy. So thank you so much. And if you'd like to learn more about stem cell therapies and what we do here at Dream Body Clinic, get a hold of us. You can go to the website at www.dreambody.clinic, or you can call us toll free at 888-704-3977. I'm Josh. Happy to help.